Hey guys, Dr. Childs here. Today we're going to be talking about the symptoms associated with Hashimoto's thyroiditis. We're going to be talking about the different categories of those symptoms, how those symptoms fluctuate over time, and it's really going to help you understand what's going on in your body and what this disease entails. If you don't know me, I'm Dr. Childs. I'm an internist and I specialize in treating thyroid problems, hormone imbalances, and also weight loss. So let's pull out the whiteboard to get started today. As I mentioned, we are going to be talking about Hashimoto's symptoms. All right. And many of you listening to this have Hashimoto's. You're probably like, why do I need to understand my symptoms? I already know how I feel. That's true. You definitely know how you feel. But what I want to do is help you understand what's actually occurring in your body and help you understand what type of symptoms you have. Because if you can understand where these symptoms are coming from, you can better understand how to target your therapies. You can better understand if you need less medication, more medication, if you can come off medication. There are a lot of things that you need to understand in order to have an idea of where you need to go with your therapies. So let's start there. And what we should do, I should also point out first, is that if you have thyroid disease of any type, this information is going to be relevant to you. And the reason I say that is because we know from studies that the majority of people with hypothyroidism of any cause, have that hypothyroidism caused most likely by Hashimoto's. The numbers are astronomical, something like 70 to 90%, depending on which study you look at. So this is going to be relevant to all people with hypothyroidism, or at least 70 to 90% of you. All right, so let's talk about this. I've broken this down into 4 separate categories of symptoms that you can experience at various times if you have this disease. And so you need to understand these things so that you can figure out what's going on in your body and where you're at. So I'm going to briefly introduce those and we'll sort of talk about these things and why they're relevant. The first is included here, and that is hypothyroid symptoms. Okay, so those people, if you have Hashimoto's, you can absolutely experience hypothyroid symptoms. In fact, most patients with Hashimoto's will eventually, start out with thyroid function here and then just go down and they'll stay there and they'll live in this hypothyroid area. Okay, so these are probably the symptoms that the majority of you will be experiencing. So that's one category. The next one would be hyperthyroid symptoms. Now, hyperthyroid symptoms are the exact opposite of those symptoms associated with hypothyroidism. So in hypothyroidism, you may experience weight gain. You may experience low energy. You may have an increase in hair loss. Your body temp is going to go low. Your heart rate is going to go low. You'll have more depression, and then you'll also have cold intolerance. So these symptoms are associated with hypothyroidism. Now, what you should know, if you don't already, is that the symptoms of hyperthyroidism are essentially the exact opposite. Yes, there are some overlap here, which you should be aware of, and I'll go over them in just a second, and this will make sense in just a sec. So if you have hyperthyroidism, you're more likely to have weight loss. You're more likely to have a drop in energy, which is the same thing up here, so both have a drop in energy. But in this case, you'll have an increase in heart rate, an increase in body temperature. You also have an increase in hair loss, although the hair loss with hyperthyroidism is slightly different. It's usually dry, brittle hair that cracks and breaks, as opposed to just your hair falling out in hypothyroidism. You tend to have more anxiety instead of depression, although you can be depressed here. You have tremors, so your hands are shaking, kind of like this. And then you also have heat intolerance instead of cold intolerance. So these are the exact opposite. So why would I bring up hyperthyroidism as a symptom or a category of symptoms that people with Hashimoto's may experience? And the reason is because, and you may or may not know this, about 5 to 10% of patients with Hashimoto's will experience a bout of hyperthyroidism at some point throughout the progression of their disease. And so what might happen is this. So let's say you start out here, you're normal thyroid, you bump up to hyperthyroidism. So this is you over the course of your life, or just various months in your life. Then you kind of stay up there for a while, you come back down, you're normal, you go back down to low hype, you go back down to hypothyroidism, you come back up to normal, you come back up to hyper, and so on. So you can kind of do this, and usually everyone ends up in hypothyroidism, but you can have periods of hyperthyroidism as you go. And this is very, very, very confusing for a lot of people who have Hashimoto's. So let me paint you a picture and I'll explain why. So imagine you are a patient with Hashimoto's and you have a period where your thyroid is low. Okay, you go to your doctor, you find out that your TSH is high. Remember, a high TSH means your thyroid function is generally low. So your doctor says, I know, we'll put you on some thyroid medication. So you start thyroid medication at this time point here. Maybe, and it bumps you up and you feel a little bit better. Then guess what happens? 2 months later, all of a sudden now, when you were experiencing these hypothyroidism symptoms, now you're experiencing hyperthyroidism because now you have the thyroid that's being pumped out of your thyroid gland because it's inflamed from the Hashimoto's, in addition to the thyroid medication that you were taking because you used to be hypothyroid. Okay, so now not only do you feel hyperthyroid, you're getting a boost from the medication you're taking and also from the native function of your thyroid gland. So this is so confusing for a lot of patients. And I want you to leave a comment below if you fit into one of these categories. If you've been like, I don't know where my symptoms are. Sometimes I feel that I'm hypothyroidism. Sometimes I feel that I'm hyperthyroidism. The reason that this occurs is because your symptoms can and may fluctuate over time. Very, very, very important. Now, what I want you to understand, the takeaway between these two main ones here, is that the majority of the time, for the majority of patients, you will be living in a hypothyroid state, the hypothyroid state. But you may have periods of hyperthyroidism. Again, that's about 5 to 10%. It can come and go, but generally, you're going to be hypothyroid. So that's number one and number two. Number three is you can be euthyroid. Euthyroid is a fancy way for saying your thyroid is normal. Okay, that's it. So what can happen is you can have an elevation in thyroid antibodies, which most people associate with Hashimoto's. All right, but that doesn't mean that those antibodies are necessarily destroying your thyroid gland. There are states, including pregnancy, where these antibodies can be elevated, but it's not an indication that your thyroid is necessarily being damaged at that time. So you have to also understand, to make things a little bit more confusing, is that just the presence of these antibodies doesn't always guarantee that you'll have any problems with your thyroid. You could just be in a euthyroid state. Now, don't base this off of your TSH, okay? So if you just look at your TSH, your doctor is going to always try to convince you that your thyroid is normal. That's rarely ever the case, okay? So this is based off of your symptoms. That's why I said here, you need to be able to say you feel fine. If you have any of these symptoms and your TSH is normal, then that's a tell that you really are hypothyroid or hyperthyroid, okay? A TSH is very inaccurate in the setting of Hashimoto's, and it cannot be trusted as the sole means of diagnosis in this disease. Okay, so do not let your doctor try to convince you that if your TSH is fine, but you still feel crappy, that you are fine. No, no, no. I'm talking about here, your lab tests are normal, also, you feel fine. Those two things have to be correct in order for this to be a euthyroid state. And this is very, very rare, by the way. So the majority of you probably listening to this, I would say you probably don't fall into this category, but there are some, which is why it's included here. Plus, you might, like I said before, throughout this cycle, you're going to feel pretty good. You'll feel normal here. You'll feel normal here. You'll feel hyperthyroid here. You'll feel hypothyroid there. So it's going to be a roller coaster for you. So you need to pay attention to that. And then the last set of symptoms that you should be aware of, I call them immune-mediated symptoms. So these are symptoms that come from the autoimmunity component of the Hashimoto's and not from its impact on your thyroid. Okay, so the hypothyroidism and the hyperthyroid symptoms, that comes because your thyroid is being attacked and it's being destroyed. Okay, so if it's being attacked and it's chronically attacked and it can't function anymore, it can't pump out the thyroid hormone. Likewise, if it's really inflamed, you can actually force more thyroid hormone out than should be there. It's just, you know, like you're squeezing on the gland and it's causing damage. It's releasing what it can. That can cause that hyperthyroid. But these are caused by damage to the gland. You can also get symptoms from the fact that you just have inflammation in your body, and that's the immune component. Remember, Hashimoto's is an autoimmune disease, which means it's affecting your immune system, which is why, by the way, that we treat it much differently than run-of-the-mill hypothyroidism. But that's for a different topic. So the symptoms associated with the immune aspect can include these, and I want you to, hopefully you can read these here because they're really important. So these symptoms tend to be things like rash, you can get a flu-like symptoms, you can get fever, a mild fever, not a high fever, but a mild fever, headaches, you can get malaise, which is just sort of like a generalized feeling that you're just sort of blah, you know, like you're not super fatigued and you're not, you know, don't have super low energy, but you're just not yourself. You know, maybe 20 or 30% lower than you should be. That's what malaise means. You might find that you're susceptible to a lot of illnesses. So maybe you're getting sick all the time, and every illness you come into contact with, you're contracting, and it's causing a lot of issues. Another thing that people will feel is they'll just feel run down, you know, just not yourself. That kind of goes up with this malaise. Not happy. So another thing that I want to point out here is that it's different than the depression seen in hypothyroidism. So hypothyroid symptoms causes depression, and this is a pretty bad depression. This I'm talking about, you're just not finding, you know, joy in the things that you were once doing, okay? And then the other one can be mild joint pain. So these symptoms indicate that there's something going on with your immune system. And these symptoms, by the way, tend to precede all of these symptoms. Okay, because normally the way Hashimoto starts is you have something flares up your immune system, and I have a video on all the causes of Hashimoto's and all those triggers, so go watch that if you haven't already. And usually those triggers cause these. So you're like, well, I'm just not feeling that great, but I'm not terrible. And then these symptoms eventually progress to these symptoms. Okay, so these immune symptoms start, and then they may cause hypothyroidism, they may cause hyperthyroid symptoms as they get worse and worse and worse. These, much like these, can come and go. Okay, so if you have a flare-up, by the way, we've talked about flare-ups before of Hashimoto's, so your symptoms can acutely get worse, which means out of nowhere. They can just suddenly get a lot worse. And generally, if you do have a flare-up, you'll experience the immune system symptoms, because that's what's happening. Your immune system is getting revved up and kind of too excited. And then they can also be associated with some of these symptoms. So, generally, like I said, it's going to be hypothyroid symptoms, but it could be hyper. So I want you to look at this list, and you're going to see that there's a lot of different symptoms, but they can be categorized. So if you're thinking to yourself, none of my symptoms make sense, or I have symptoms of hypothyroidism and hyperthyroidism, which does happen, by the way, and you're not sure, you're like, where do I fit? Look at these categories and try to figure out where you fit in, because you're never going to fit into both these simultaneously, the hypo and the hyperthyroid. That's just not possible. You can't have a tissue. You can't have certain tissues in your body that are overstimulated and some that are understimulated, but the same tissue can't be both overstimulated and understimulated at the same time. It doesn't work that way. But you will see also that there are some similarities in terms of these symptoms. So try to find generally the box that you fit in, okay, in terms of your symptoms, and then that will help you figure out where are these symptoms coming from. If they're coming from your immune system, well, then you can treat that. You can use supplements and therapies and lifestyle changes to address and lower your immune system or the immune dysfunction that you're experiencing. If you're thyroid, there's nothing you need to do. If you're hyperthyroid, you can still focus on the immune aspect because that's really important, but you might also want to concentrate on things that might reduce thyroid function as well. And then if you're hypothyroid, which is, again, probably where many of you live, you can take supplements to help enhance thyroid function, to lower that immune dysfunction, and so on. But it all starts with understanding where you fit in here. Very, very, very important. Okay, so I want to hear from you guys. Make sure that you get a mental picture of this. Pause the video if you need to, write it down, whatever. But keep an eye on these symptoms. And I want to hear from you guys. Are you somebody who has had very confusing symptoms? If you are, I want you to leave your comment below. Because what you're going to find is that there's a lot of you out there, and if you start sharing your experiences, then a lot of people are going to be like, oh, I'm not the only one. And I have the advantage of treating a lot of people, so I see this, right? But there are many of you here who are like, I wonder if anyone has ever experienced this. I promise you people have experienced it. So leave your experience, leave your comment below. If you have any questions, go ahead and leave those below as well. And make sure if you haven't already to subscribe. I also have a free PDF document of 8 different resources that are helpful to patients who have thyroid disease and Hashimoto's. So if you want those, the link will be in the description below. And otherwise, I'll see you guys in the next one.